As we get back to a sense of normalcy, many still have so many questions about the coronavirus, and I'm joined by Dr. Henry Anyimadu. He's an infectious disease specialist at the Hospital of Central Connecticut to answer some of the questions that have come in from our viewers. Thank you for being with us, Doctor.
Thank you for having me, Kara.
Yahara in Hartford asks, I have a 2-year-old with chronic asthma and his grandma got diagnosed with COVID. How long after she tests negative will she be able to be around him again without that being an issue for him?
You know, the CDC has clear guidance on this. After 10 days since your initial symptoms, if your symptoms are improving and you haven't had any fever for 3 days without taking any fever-reducing medications, including Tylenol or ibuprofen, you can safely spend time with your loved ones. But if you choose to get tested, which is probably what I will do around the vulnerable 2-year-old, then you need 2 negative test results at least 24 hours apart.
Okay. And this is from Anonymous. I heard there were different strains of COVID-19 and the one in New York had the bad one. Are there different strains? And is there a strain that's better to get, one that's less serious? What strain is in Connecticut?
So that's a very loaded question. You know, scientists are very conflicted about the idea of different serotypes of SARS-CoV-2. Earlier on in the pandemic, there were some Chinese researchers that described 2 different serotypes. They described the L and the S, but their claim was quickly refuted by researchers from University of Glasgow in UK. So SARS-CoV-2 is an RNA virus, and replication of RNA viruses is very, very sloppy. So mistakes happen all the time, leading to many genetic mutations. But as of today, we don't have any evidence to suggest that these genetic mutations have changed the biology and function of the virus. There may be different strains, but the way they cause disease and how our body responds to them haven't changed at all.
Okay,
so the
it's
answer
sort of the same.
to your last question is that there is no coronavirus that's better to get.
Okay. Another question from Sandra in Bristol. I had the coronavirus and recovered. I didn't think I'd survive it due to my underlying conditions, yet here I am. So what are my chances of getting it again?
Sandra, you know, miracles do happen, and we are glad that you're still here. The simple answer to your question is that we don't know. We expect you to have some antibodies that will protect you from reinfection. But not everyone who survives COVID-19 actually develops antibodies. And even for those who develop antibodies, we don't know how long those antibodies will last. You know, research is still ongoing to better understand reinfection.
Okay.
So I will urge you to continue taking precautions, hand hygiene, physical distancing, and masking.
Okay. LIZA and Niantic, is testing available for people with no known exposure or symptoms? Our son and daughter-in-law are coming from South Carolina, and we would all like to be tested.
Oh, yes, you can get tested. The good news is you can drive to any of the Hartford HealthCare testing centers and get tested. You don't even need a doctor's order, and you don't even have to have symptoms.
All right, that's perfect. And there's information on the Channel 3 app about that. But yes, no matter who you are, you can get tested. And even the tests are free. I know in Hartford, they'll even drive you if you dial 211. So thank you so much for being with us, Doctor. And we look forward to seeing you again and answering more questions in the future.
You're very welcome. It's always a pleasure.